So blepharoplasty. We all get less young and we all want to look a little bit younger. One of the things around the eyes is that you can get baggy skin. You get baggy skin of your upper lids, you get baggy skin of your lower lids, and a lot of patients do not like that at all. It's not vanity. I can completely understand it. And a lot of my patients are so delighted with the outcome, so it improves them psychologically. And in the end, I'm here to look after the patient holistically, so I'm perfectly happy to sort them out. The most common one is upper lid excess skin. The skin just builds up and then it starts lying on your lid, it starts lying on your lashes, it makes you look tired all the time and it can have major issues. Ladies tend to be more concerned with men, but strange enough, of the blepharoplasties I do, probably 40% are men. So this happens to men and women and it's nothing to be ashamed of. The operation for upper lid blepharoplasty is really quite straightforward. I tend to do it under local anaesthetic, so I freeze the eye up just around the skin and then I take an ellipse of skin away and suture it back up again with a nice lot of stitches. It means you have a nice little scar which is hidden in the fold. Now my aim is not to take away all the lid tissue because that can make you look abnormal. It can give you an image like a startled rabbit all the time. It's not a good look. My aim is to take away enough that it offloads you and makes you look younger and fresher. But I don't want people to notice this and I don't want people to say, what have you had done? The aim is to look natural, the aim is to look younger. The swelling occurs in the early stages and the swelling doesn't fully dissipate until 6 months after the operation. So you will notice that you wake up in the morning and you're a little bit puffy and swollen, but that will improve for you. That's the upper lid. Quite straightforward, quite easy. Done in theatre, local anaesthetic, about 20-minute operating time. The lower lid is a little bit more problematic. Sometimes people have excess lower lid skin and you see some wrinkles down here just beneath your lids. That is reasonably easily sorted out as well. We make an incision just underneath the lashes and then we pull the skin up and tighten it. It leaves a little scar there, but it's usually completely invisible. It can sometimes cause the lid to bow forward a bit, and if that's the case, then I tighten the lid up for you to get it sorted out. Again, we can do that under local anaesthetic and it's easily sorted out. Again, a 20-minute operation, we'll be chatting throughout the whole thing, so it's fine. We tend to do both sides at the same time. You have a pad on one side, which is the more puffy side, and then you don't have anything on the other side at all. When it starts getting a bit more complex is when you have fat prolapse. If you imagine the orbit, it's a bony orbit. Imagine a skull, the orbit sits there and it's bony. The globe is like a little golf ball and it sits within that. And surrounding it is lots of fat to allow it to move around. As we get less young, that fat starts to move forward. There's a little membrane called the septum. And if you imagine the globe sits in there and then the septum goes up and down to attach to your bones here, that becomes weaker and starts having gaps in it. And the fat pushes through. And that's why you get the little lumps beneath it. It's called fat prolapse, and the fat pads are one of the issues which we see quite frequently. It is easily sorted out. We go through the same incision as we would for an ordinary skin blepharoplasty, and I go down and I actually actively take away those fat pads for you. My aim is not to take away too much. As we get older, the fat atrophies, so it disappears anyway. And if you look at some old people, they've got very, very sunken eyes, and that's because they've lost all the fat around the orbit. So I don't want to have you looking like that early on and then you're looking even worse in future years. So my aim is to stop the fat prolapsing out. The operation is a bit more convoluted. There are a few more risks with it because we're working around the orbit and there are very fragile blood vessels and sometimes people can get hemorrhages there. Really, really infrequently, but it's nothing to undertake lightly. We can do it under local anaesthetic, but I don't tend to like that because often we combine it with upper lid blepharoplasty as well, and it's a bit more of an invasive procedure. So most operations I much prefer local, but if we're doing both upper and lower lids and fat excision, then I prefer to do it under general anaesthetic. So you're fast asleep, you feel a bit groggy afterwards, and you will look bruised and battered. It's like being punched in the eyes. You will have black eyes on both sides, and that is something which sadly you have to accept. So it takes a good 2 weeks to get over completely, and after 2 weeks nobody should notice that you have anything done. You have stitches out after a week, you come back and see me and I make sure everything's okay. We can always tweak you later on, but remember the aim is not to take everything away completely and have a hollow under your lid, which would mean that you have to have it filled again. It's to leave it so that the fat isn't prolapsing out so much and you have a tiny little fat there. Again, I want you to look natural, I want you to look healthy, I want you to look revitalised. It makes a massive difference to quality of life. There are risks. Scar we hide for you, infection is always the risk, but Thankfully, it happens very, very rarely. Bleeding is a risk and you will look bruised and battered. So if you're on any medication to thin your blood, we need to have a chat about that. In the end, it's a very, very welcome procedure. It's a reasonably safe procedure and it makes a massive difference to quality of life. We'll talk about it in depth, make sure we're doing it for the right reasons, because that's important as well. Often I'll try and talk you out of it, but if you really want it, I'm more than happy to look after you and sort it for you.